You're someone who uh, really wants to understand the big picture, right? Especially with these major global events constantly shifting things.
Yeah, and keeping up is, well, it's tough. Information overload is real.
Definitely. So today we want to cut through some of that complexity surrounding a really significant development.
We're doing a deep dive into this newly drafted global pandemic treaty. It's a legally binding agreement that WHO member states have been working on.
And it's a pretty big deal, historically speaking.
Absolutely. This is only the second legally binding treaty in the WHO's entire history.
The only other one was, what, the Tobacco Control Treaty from 2003?
That's the one. So that shows you the kind of weight these things can carry. This new one aims to do something similar for pandemic preparedness and response.
Though it's important to mention up front, the U.S., well, they're not part of this agreement currently.
Right, a significant point we'll come back to. But our mission today is really to pull out the core pieces of this treaty. What does it actually say? And, why should you care about its potential impact?
Especially if you're tracking global developments closely.
Exactly. We've looked at reports from, i.e., the WHO itself, the BBC, to kind of synthesize the key information for you.
And this didn't just appear out of nowhere, did it? It's very much a response to, well, to COVID.
Precisely. It's a direct result of the, frankly, painful lessons learned during the recent pandemic.
I mean, think back to late 2021, that Omicron surge. The vaccine situation was stark.
It really highlighted the massive inequalities. You had wealthy nations essentially hoarding doses, securing huge stockpiles.
While many other countries were left scrambling with very little access.
And this wasn't just, unfortunate. It had a devastating human cost. There was a study in Nature, I think, in 2022.
Yeah, I remember that.
It estimated over 1 million preventable deaths just due to that unfair vaccine distribution.
1 million deaths.
Wow.
Directly linked to lack of access. That's sobering.
It really is, and it underscored this urgent need for a fairer, more equitable system.
It wasn't just about the supply chains, was it? There was
Yeah.
criticism about the overall response.
Right. The Independent Panel for Pandemic Preparedness and Response back in 2021, they didn't mince words.
No, it didn't.
They pointed to poor strategic choices, deep-seated inequalities, and just a fundamental lack of global coordination as things that made the pandemic much, much worse.
So this treaty, which got started back in December 2021, is basically the world saying, okay, we need to do better.
It's an attempt at a coordinated global response, learning from those failures. So, okay, let's get into the actual substance. What's in this agreement? What are signatory nations signing up for?
Let's start with this concept, pathogen access and benefit sharing. Sounds a bit technical. What does it mean in plain English?
Okay, so basically it's a two-way street. Pharmaceutical companies, researchers, they get faster, more predictable access to pathogen data.
Like virus samples or genetic sequences, stuff they need to develop countermeasures.
Exactly. Crucial information. In return for getting that access, there's a commitment, a requirement, actually, to share the benefits that come from it.
Benefits, meaning the vaccines, the drugs, the tests that they develop using that data.
Precisely. Sharing those equitably during pandemics. The goal is to stop situations where vital information or life-saving products are, locked up by just a few countries or companies.
So it's trying to prevent the highest bidder scenario we saw before.
That's the core idea. And a really concrete part of this is the mandatory allocation to the WHO.
Ah, right. Tell us about that.
Okay, so under the treaty, manufacturers who sign on, they're obligated to give 10% of their pandemic products, vaccines, treatments, diagnostics directly to the WHO.
10%, free of charge.
Free of charge. That's a potentially huge shift, moving away from every nation for itself towards a more centrally coordinated pool of resources managed by the WHO. Of course, its effectiveness depends on who actually signs up.
That does sound significant. Ensuring a baseline supply for maybe more vulnerable populations. Is there more beyond that 10% donation?
Yes. There's a second tier. An additional 10% of those same products have to be made available to the WHO, but this time at affordable prices.
Okay, so 10% free, 10% affordable. 2 layers of access.
Exactly. Trying to address both immediate need and longer-term affordability, especially for lower-income countries.
What about building capacity within countries? So they're not just waiting for handouts, essentially.
Good point. The treaty tackles that too. It talks about technology and knowledge sharing.
Also.
Member states are basically expected to encourage, maybe even incentivize companies to transfer the tech and the know-how needed for manufacturing.
To developing countries.
Yes, to help build up local manufacturing capacity. The idea is fostering self-reliance, so countries aren't entirely dependent on external suppliers during a crisis.
That feels vital for long-term resilience, not just aid, but empowerment.
Absolutely. And there's another angle related to funding. The treaty puts conditions on publicly funded research.
Meaning, if taxpayer money helped develop something.
Right. If universities or private companies use public funds for R&D on treatments or diagnostics, the treaty requires signatory countries to have policies ensuring that those resulting products are accessible.
Accessible how? Like affordable and available quickly during emergencies.
Exactly. Equitable and timely access. It aims to prevent situations where breakthroughs funded by the public are then priced so high that the public or other countries can't actually access them when they're needed most.
So public investment should lead to public benefit, especially in a crisis. Makes sense. Does it go further on access?
It does. It explicitly empowers governments to step in,
How?
to take action to ensure access to life-saving medicines developed with public funds, specifically when they are unaffordable or inaccessible. It allows governments to intervene, basically.
As a sort of backstop if the market doesn't deliver equitable access.
Precisely. A safeguard for their citizens and vulnerable groups globally.
This paints a picture of a much more cooperative and hopefully equitable approach for the next pandemic. But there have to be catches, right? Criticisms.
Oh, absolutely. While it's a big step, it's definitely not perfect, and there are some major caveats and criticisms.
Like what?
Well, first, and maybe most fundamentally, the WHO's authority is actually quite limited under this treaty. Clause 24 is very specific about this.
What does it say?
It says the WHO cannot directly tell countries what to do regarding their national laws or policies. It can't enforce travel bans or lockdowns or vaccine mandates or things like that.
So it's not creating some kind of global health police force.
Not at all. It's more a framework for countries to agree to cooperate and commit to certain principles rather than giving the WHO enforcement power over national decisions.
Okay. But if it can enforce things.
Exactly. That leads straight to the next major criticism. There's no real enforcement mechanism.
So if a country signs on but then, in a crisis, decides to hoard resources anyway, what happens?
Well, that's the concern. There aren't really any specified consequences. The fear is that national interests could easily override the treaty commitments again without penalty. That significantly weakens its practical power.
Right. That seems like a pretty fundamental weakness. What about the companies, the pharmaceutical industry? Are they happy with this?
They've definitely voiced concerns, particularly around intellectual property rules and how this benefit-sharing system will actually work.
What's their argument?
They argue that if the rules are unclear or too restrictive, it could discourage the massive investment needed for pandemic R&D, which is already high risk and very expensive.
Wow.
They're calling for more legal certainty.
To ensure innovation isn't stifled.
That's their perspective, yes.
Yeah.
Maintaining those public-private partnerships is key, they argue.
Are there other parts of the treaty that feel a bit vague?
Yes, that pathogen access and benefit sharing system we talked about earlier, the PABS system.
The core reciprocal deal.
Right. Well, the detailed rules for how that actually operates, they're not fully fleshed out yet. There's a lack of specific implementation guidelines.
And why is that a problem?
Because it raises questions about how practical it will be in a real fast-moving pandemic.
Yeah.
Without clear rules, you could get delays, disputes over data access or benefit sharing, exactly what the treaty is trying to avoid.
Okay, lack of clarity there.
Yeah.
And then there's the elephant in the room. The U.S. not being involved. How big a deal is that?
It's a very big deal. The U.S. is just such a major player in global health, in vaccine and drug development, funding.
A powerhouse, really.
Absolutely. So their absence is seen by pretty much everyone as significantly weakening the treaty's potential impact. Some experts have literally called it a gaping hole in global preparedness efforts.
Because without them, the treaty's reach and influence, especially on R&D, is just much smaller.
Undeniably. It's not just about one country missing. It's about a key driver of innovation and a major global health funder being outside the framework. It potentially undermines the whole effort.
Okay, wow. So let's try to pull this all together. If someone asks, what's the bottom line on this pandemic treaty, what should they know?
Well, the bottom line is it's complicated. On one hand, you have this landmark, legally binding agreement that's huge. It aims for much better global preparedness and equity. It sets up frameworks for sharing, for allocation to the WHO, for tech transfer, all important stuff. But on the other hand, it has significant limitations. The WHO doesn't really have enforcement power. Key details, like the benefit sharing system, are still unclear. The pharma industry has concerns. And critically, the U.S. isn't part of it.
So step forward, maybe a necessary one, but definitely not a magic bullet.
Exactly. It's a really important attempt to learn from COVID, to build a more resilient global system. But its actual success, that's going to depend on a lot of factors going forward, and it will have real consequences for everyone.
Which leads to the big question, doesn't it? Thinking about the future, given these limitations, especially the lack of enforcement, what else needs to happen? What are the critical next steps for countries, for the global community, to actually make sure we're ready and the response is fair next time?
That's the million-dollar question, isn't it? This treaty, even with its flaws, really highlights the need for ongoing effort. It's not just sign the treaty, job done. It means individual countries need to keep strengthening their own public health systems, investing in R&D, building trust. Globally, it means finding other ways, maybe diplomatic pressure, maybe other forums to encourage cooperation and compliance, even without formal enforcement in this specific treaty.
So the treaty might be more of a starting point for conversation and commitment rather than the final answer.
I think that's a good way to put it. It signals a shared understanding of the threat, but turning that into effective action requires continuous political will to prioritize global health, sometimes over narrow national interests. That's the ongoing challenge.
And for those of you listening who are preparing for the UPSC exams, this whole topic is incredibly relevant.
Oh, definitely.
It hits on international relations, global health governance, equity issues. Understanding the treaty's aims, its mechanics, and its limitations is really crucial. Could definitely see this coming up in prelims or mains.
It's a perfect case study, really, in the challenges of global cooperation on shared threats in our very interconnected but also very divided world.
So if you found this deep dive helpful and you want us to tackle more critical global issues like this, please do hit like, subscribe to the channel, and maybe drop a comment below. Let us know what questions you still have or what other topics you'd like us to explore.
Yeah, we really appreciate the engagement. It helps us figure out what's most useful for you.
And just a final reminder, our discussion today drew on reporting and information from, i.e., the World Health Organization and the BBC. Thanks so much for joining us for this deep dive.